applying some gel prior to the treatment of the Epat, in this case for plantar fasciitis. And it's a option that can cure plantar fasciitis in some instances. A lot of athletes like this treatment because it is no needles and no medications. And what we do is deliver 4,000 pulses at different intensities, starting low and then building up over time. This treatment is, we do 5 treatments a week apart. So it's done for 3 times or weekly or up to 5 times. Runners see value in this situation, people that hike, people that do a lot of walking, who have a difficulty with plantar fasciitis, come for these treatments.
Is there downtime after the treatment? Can you just go?
There are some restrictions. We prefer that there is no elective activities during the treatments if possible. So we ask people that hike and walk, competitive athletes, that they restrict their activities during the treatment course. We also ask that non-steroidal anti-inflammatories like Advil, Aleve, or Motrin not be used, and that ice not be used during the treatments, because this is triggering a inflammatory response, and we're not wanting to mute down that response. We want it to heal. And it is a increased perfusion to the area, so the sound waves, and through their intensity, increases blood flow or perfusion for healing. And the importance of blood flow to healing is poignantly illustrated when we talk about how important blood flow is to the heart. If we don't have it, we have a heart attack. If we have compromised blood flow to the brain, we have a stroke. So in this case, we're triggering increased perfusion or blood flow into the plantar fascia, and we're also treating the calf muscle, because the calf muscle is a circuit in this situation from traveling through here to the Achilles tendon to the plantar fascia. So if our Achilles tendon is tight, because the calf muscle is tight, it's pulling on the whole circuit or mechanism. So that's why we treat this way. Plantar fascia along the Achilles tendon and up through the calf muscle or the gastroc.
This is a pretty common injury for a lot of athletes, not just runners, but tennis players, basketball players.
Right,
it is particularly.
Yeah, exactly. Anyone who's on their feet and performing repetitive activities. Yeah, and you see it sometimes not even in the athletic population. When you have pronated or flat feet, it's a big strain on the feet, and oftentimes there's an associated plantar fasciitis. People that use orthotics sometimes have plantar fasciitis, actually, in women who wear high heels over the hours. Also develop problems with their Achilles tendon, which shortens, and their plantar fascia.
Of course. People usually get it in one foot, not 2, or it could happen
Yeah,
at the same time.
Yeah, it can be the same time, but it often presents with one foot, and usually the dominant foot. And the dominant foot doesn't mean that it's a right-sided problem if you're right-handed. And sometimes it's the dominant foot in the athletic activity that you perform, or it's the more flat foot, or the more supported foot. So, but in general, we find that it's best to treat both, because you take a step with one foot, you take it with the other foot. So we cycle through our gait, and both feet are involved.